Great. Thank you very much. For everyone, thank you very much for joining us today. This part of the webinar was supposed to be given by Dr. Carla Orozco. However, due to unforeseen events, she's not able to participate today. Okay, so on to the presentation. So today we at UNICEF Philippines, we are here to share with you a recently conducted case study on the real-time vaccination monitoring and analysis, or what we call RT-VaMA, a digital initiative supported by the UNICEF's Office of Innovation. RT-VaMA started way back in 2019 as our programmatic response to the Philippines polio outbreak. So the Philippines Country Office developed survey forms and dashboards that help the Department of Health to quickly deploy real-time monitoring during the immunization campaigns, enabling quick, responsive, and predictive decision-making. From that experience, we had streamlined these digital tools into templates that can be used and customized by a country office or a government partners for real-time monitoring of immunization campaigns. So the available data collection templates on the RT-VaMA toolkit include facility readiness assessment, supplemental immunization activity monitoring, social mobilization indicators, rapid coverage assessments, and synchronized vaccination monitoring. Each plays a vital role in strengthening immunization campaigns. Okay, now let's take a closer look at the RT-VaMA in action.
Organizing immunization campaigns can be a complex process. To reach all eligible children for immunization swiftly, we need reliable and timely data. From ordering the correct number of vaccines to ensuring they reach children at the right time and at the right place, governments would need quick access to accurate data for an efficient immunization response. However, immunization data is not always available in areas without sufficient access to technologies, such as computing devices and the internet. Monitoring immunization campaigns is still paper-based, which takes time and effort to process, analyze, and translate data into information that will allow decision makers to respond quickly. By the time information reaches decision makers, it becomes obsolete. At every step of the immunization campaign, immediate data would be critical to map areas where support is needed. Adopting real-time monitoring, or RTM, would be beneficial to address the gaps in paper-based monitoring. RTM is made possible by using digital technologies that accelerate the collection, sharing, and processing of immunization data to provide real-time information for decision makers. RTM can be adopted for immunization campaigns with RT-VaMA, short for Real-Time Vaccination Monitoring and Analysis. Developed by UNICEF Philippines, RT-VaMA is a digital toolkit comprising data collection templates, dashboards, and other supplementary knowledge resources to quickly deploy real-time monitoring during immunization campaigns. Currently, RT-VaMA has 6 data collection templates: the Facility Readiness Assessment, Synchronized Vaccination Monitoring, Supplemental Immunization Activity Monitoring, Supplemental Immunization Activity Target, Social Mobilization Indicators Assessment, and lastly, Rapid Coverage Assessment. Based on data gathered and aggregated from the template, RT-VaMA can visualize immunization data in real time for monitoring and analysis. RT-VaMA is supported by 3 component technologies: Open Data Kit for data collection, Inform for data aggregation, and lastly, Power BI and Superset for data visualization. In immunization campaigns, health workers can use ODK to collect data in real time on Android devices, even in areas without the internet. Once data are submitted by health workers via ODK, they will automatically go to Inform for aggregation. Aggregated data can quickly reach decision makers through Power BI or Superset, tools that can be used for data visualization. Through dashboard reports, decision makers can quickly assess the ground situation and address implementation bottlenecks in the immunization response. With RT-VaMA, decision makers are equipped with the right tools for fast, efficient, and effective evidence-based decisions for high-quality immunization campaigns. RT-VaMA is a tool that can make real-time vaccination monitoring possible, contributing to helping children access timely the vaccinations they need. If you have more questions about RT-VaMA, reach out to us at inform@unicef.org.
And with that, we invite you to check out the RT-VaMA toolkit from UNICEF. So this slide, we have the QR code and login details that you could use to access our resources. You can also reach out to us for more details or if you have any questions. And now I give the floor to Jessica for her findings on the RT-VaMA case study.
Thank you, Aljen. So I hope for everyone we have piqued your interest in learning more about the RT-VaMA initiative. So if you have any questions, just free to type in your questions and we'll attend to them after the presentation. But before I delve into the key findings of the case study, let me first acknowledge those who have supported the development of this report. First and foremost, our colleagues from UNICEF Philippine Country Office, the Office of Innovation, East Asia Pacific Regional Office, and the Immunization Program at UNICEF headquarters. Their contribution is instrumental for us to share this rich knowledge and learn as an organization from the Philippine RT-VaMA experience. So UNICEF is actively involved in supporting digital health technologies to achieve results in key areas such as maternal and child health. And RT-VaMA is one of the many initiatives that is being supported by the Global Innovation Portfolio. And similarly, this case study is being commissioned by the Office of Innovation. UNICEF also leverages the use of innovations in supplemental immunization activity and mass immunization campaigns, as these strategies are effective in delivering vaccination services for children who might have been missed by the routine services. And globally, the Philippines is one of the top 5 countries in the world that has the largest number of zero-dose children. And according to the 2023 UNICEF State of the World's Children report. And we hope that these innovations can help make data available and thus help in improving successful campaigns. So in the Philippines, the RT-VaMA initiative is trying to address the challenge in making timely and reliable data available for program managers to make decisions and course corrective actions. In the Philippines, there are a lot of reasons as to why data is not always available for program decision making and actions. And one of which is Philippines being a country characterized as a geographically dispersed archipelago. There are several local health facilities that lack digital infrastructure. And health staff from these local health facilities would resort to paper-based reporting or non-automated databases such as Excel. Next slide, please. So the use of real-time monitoring solutions, as illustrated by the video earlier, has demonstrated its effectiveness and efficiency in improving successful campaigns. RT-VaMA uses ODK-based data collection forms, dashboards, and knowledge resources to improve vaccine campaigns. So as mentioned by Aljan earlier, the ODK-based data collection was first introduced in 2019 when UNICEF and WHO supported the Philippine Department of Health in its polio outbreak campaign. After that, DOH has adopted the ODK ONA monitoring tool as its official campaign tracker and hosts this tracker in its website in its subsequent campaigns in 2020 and 2021. And learning from the successful pilot deployment from 2019, this year, UNICEF, in close collaboration with DOH, has deployed the RT-VaMA in its MRO-PVCA, particularly using the 2 data collection templates, the readiness assessment and the rapid convenience monitoring. So the video earlier mentioned this, but I'll just quickly say that the RT-VaMA uses 3 technological components. the ODK as a data collection tool, which is ODK is a digital public good. And after that, the data is aggregated in UNICEF Global Aggregator platform called Inform, and data visualization. RT-VaMA uses Power BI and Superset. So RT-VaMA uses 6 data collection templates depending on the phase of the immunization campaign. So before the campaign, a facility can use the readiness assessment tool and monitors its own preparedness depending on the indicators such as vaccine availability, cold chain and logistics, planning and coordination, financing, and among others. While in the campaign, there are several forms that could be used by the facility, and these forms monitors the actual vaccine campaign coverage data. There's also a tool that monitors the availability of the vaccine as compared to the targeted population. There's also an assessment tool that monitors social mobilization indicators such as refusals and deferrals and identify the causes behind these refusals and deferrals. At the latter part of the campaign, the program manager can use the rapid coverage assessment or the rapid convenience monitoring form and look into which areas have missed children and plan map-up activities. So essentially, all throughout the campaign, we could see that what is important is to make sure that the data is available for the program managers to make decisions and course corrective actions during the campaign itself and not after. So here, if you visit the RT-VaMA SharePoint website shared earlier, you can look at the toolkit. And on the toolkit, there are different pages or sections. So there's a section on the in-depth overview of the RT-VaMA initiative, why there is a need for real-time monitoring solutions during vaccine campaigns. There's also a page on the different step-by-step guides intended for the administrators and the users. There's also a section with the deep dive video references. So that was really the intention of for this case study. The case study was to basically document the detailed experience when UNICEF Philippines, in collaboration with the Department of Health, has deployed the real-time monitoring solutions in the vaccine campaigns. So the scope of this case study was from the pilot deployment in 2019 until the preliminary phases when RT-VaMA was used for this year's MRO-PVC. The case study also aims to identify the factors that affect the uptake and the use of the tools, and also identify the key emerging good practices and the lessons learned. So for this case study, we utilize a qualitative primary data collection using different methods: key informant interviews, focus group discussion, and online surveys. So for the key informant interviews, we've interviewed 13 participants, mainly from the Department of Health sub-national levels, the regional and provincial health offices. We've also interviewed key UNICEF staff who were involved in the deployment. And also we did document and literature review. Central to our document and literature review was the two UNICEF Gavi resources. The 2021 document or report also has similar case studies from 4 countries using real-time monitoring solutions, experiences from Pakistan, Indonesia, Uganda, and Zambia. Meanwhile, the recent 2022 UNICEF Gavi document had the practical recommendations on how to deploy real-time monitoring solutions in vaccine campaigns. Okay, so in our case study, we've identified different challenges that we've encountered during the deployment of the real-time monitoring solutions in vaccine campaigns. So one that has really emerged from our primary data was the challenges in human resources, specifically the competing demands from overworked RHU staff who who were doing simultaneous tasks such as patient care, data collection, data entry. And in the Philippines, when conducting immunization campaigns, temporary data encoders are hired during these campaigns. However, not all health facilities have the financial capacity or the financial support from the local chief executives to hire their own data encoders. Another problem that we saw in human resource was a low motivation of some staff to use novel technologies. Particularly, we've seen this among older staff would rather prefer to use paper-based reports or non-automated databases such as Excel. We also saw from the case from our data collection staff turnover which is very critical because then there is a need to continuously train new staff on this real-time monitoring solutions. At the central office, DOH central office, staff turnover has impacted severely the availability of technical expertise and skills in during the design and customization phase of the data collection templates for the 2023 MRO-PVC. Another challenge that emerged from the data collection was there were data reporting delays. We hope that with real-time monitoring solutions, data would become available in real-time or in near real-time basis for program management or decision making. However, in a country like Philippines, where there are areas with terrain difficulties and also with areas geographically isolated and depressed areas or GDAs, internet connection and mobile signal connectivity is not always ensured. So what happens, for example, the vaccination team will go to these GDAs and after they would stay there for 2 to 3 days. And then after that, they would come back to the rural health unit, and that's the time they will upload their data once there is an internet or mobile signal connection. There were also initiatives from their program managers at the provincial health office or the regional health office, and they would call these facilities and inquire about their daily vaccine coverage data so that the program managers will be the one uploading the facility data in the system. And there are also some problems with the mobile phone use. Other users reported that they had difficulty entering the data on small screens in their mobile phones. There were also users who were concerned that their mobile phones will be stolen when they use this publicly. Other minor issues that were identified during the pilot deployment was there was a short planning period for deployment because as you know, when the ODK ONA was piloted in 2019, it needed to be deployed urgently to support the outbreak campaign. There were also issues in duplicated data entry process during the pilot deployment because this was the first time that the Philippines used a real-time monitoring solution during their vaccine campaigns. So they wanted to ensure that the system, if it's still not ready, there is a backup database process supporting that system. But those are just minor issues. Double reporting, on the other hand, was also an issue seen for areas with poor internet connection. So in our case study, we were also able to highlight several advantages of using RTM solutions. The main advantage was really for the data to be readily available for program managers and use this information for their decision making and course corrective actions during the campaign. So this information would help them do actions that would make or ensure that their campaigns are successful. Another advantage of using this real-time monitoring solution is that the ODK, which is a digital public good, is easy to use. So the ease to use this tool also contributed to the buy-in and the sustainability of the use of the health staff. And these real-time monitoring solutions also have low internet requirements and offline options, and it doesn't require expensive hardware needs. So these solutions are suitable for low resource context. And since data is being aggregated on the global aggregator platform by UNICEF called Inform, there's an added secured and authorized lag on details provided to the users. So the data is not easily accessed. And for the 2023 MRO-PVC, the information that was collected did not require confidential patient information. So this was the actual dashboard during the 2023 MRO-PVC, looking into the readiness of the facilities. So by looking at the dashboard, the program manager can easily identify which areas have lagging preparedness. So the manager can easily identify which areas needed vaccines or which areas needed additional staff. So when the campaign starts, the facility is ready to implement their campaigns. So since the case study documented the preliminary results of the use of RT-VaMA during the 2023 MRO-PVC, so these are some of the quantitative results. There were 858 health workers trained. 59% of the health facilities used the readiness assessment tool, because when the RT-VaMA was deployed, there were already facilities that have submitted their readiness assessment to their program managers. So there were a total of more than 300,000 children visited using the rapid convenience monitoring form. Next slide, please. So the case study identified different key emerging good practices when the real-time monitoring solutions were deployed in vaccine campaigns in the Philippines. We know that sustainability of use is always challenging among health staff. However, we found out that the government buy-in helps in the scale-up and sustainability of the use of these tools. And the buy-in from the Department of Health was quite evident when they adopted the ODK ONA as their campaign tracker during the 2020 and 2021. And in 2023 MRO-PVC, DOH has developed several policy and administrative guidelines to encourage the use of RT-VaMA. We've also identified a good practice wherein a good stakeholder collaboration can help mobilize resources and support for the vaccine campaigns. So another good practice was really placing the users at the center of the technology. By adopting human-centered approaches, such as assessing the information and reporting needs of the different administrative levels, and continuously consulting with the DOH partners in designing and customizing the data collection templates, to make sure that the dashboards, the templates, and the reports align to the needs and the context, not only by the central office, but also the other administrative levels, such as the provincial health office or the regional health offices. So aside to that, the RT-VaMA project team also helped establish additional support mechanisms or channels in addressing the concerns of the users. And finally, another good practice that we have identified was to establish a strong feedback mechanism or coordination mechanisms. For example, in the immunization campaigns, there are regional and national management and coordination meetings, which regularly reviews the reported campaign data and provide feedback and make decisions or course corrective actions. So in our case study, we've identified key lessons learned in implementing RTM solutions in vaccine campaigns. So when we introduce a new digital tool, the users come with different backgrounds and understanding. So it is really important to recognize the uniqueness of these target users and leverage their available technical expertise or skills. So in a devolved health system such as the Philippines, there is the variation how subnational levels implement a digital solution. There's also differences in digital maturity and variations in the level of support that the health facilities receive from their local chief executive. So one good example that we saw was during the 2019 pilot deployment when there were regions initiating to create their own data visualization dashboards and host their dashboards in their own regional websites. So another lesson learned is to make different learning materials or resources or support help desk available for the users to allow easier uptake and also to improve their learning. So as mentioned earlier, RT-VaMA is an important, the RT-VaMA toolkit is an important component of the RT-VaMA initiative because then it has these different learning materials uploaded in one website that can be easily accessed by the users, by the administrators. So aside to that, the RT-VaMA team created several help desk channels, Rapid Pro, creating Viber groups to accommodate the questions of the users. So another lesson learned was that we've learned that it's important to understand appropriate governance structures. In implementing immunization campaigns in the Philippines, immunization campaigns usually requires the involvement of many departments or offices at the Department of Health Central Office, KMITS, Epidemiology Bureau, the FICT. So therefore, it is recommended that for future deployment of tools or other innovations, there should be a technical working group. Meanwhile, within the UNICEF organization, we've also identified key lesson learned, which is to establish effective knowledge sharing between the program or the health specialist and the technology for development specialist. And finally, we've learned that it's also important for M&E or knowledge management systems supporting these digital health innovations be established to improve institutional learning. So aside from the emerging practices and the lessons learned, the case study report also has some practical considerations or recommendations on how we could deploy real-time monitoring solutions. And these recommendations have already been touched on earlier in my previous slides. So the case study has documented the early success of RT-VaMA in enhancing the vaccine campaigns in the Philippines. And at the regional level, RT-VaMA is being scaled up by expanding its use in other countries. Currently, similar ODK-based monitoring tools are also being deployed in vaccine campaigns in countries such as Papua New Guinea. And at the global level, scaling up RT-VaMA also supports the expansion of Inform, which is UNICEF's global aggregator platform. There's also some work in contributing broadly to the digital health work and capacity building initiatives of the Office of Innovation and Immunization Program Group at the headquarters. I would also like to invite my colleagues from UNICEF Philippine Country Office if they know other recent updates on the scaling up of RT-VaMA. So that's all. Thank you all for listening. So these are the two reports that I've mentioned earlier, the UNICEF, the joint UNICEF and Gavi documents. So thank you, everyone.
All right. Thank you again, Sir Aldrin and Ms. Jessica, for presenting the RT-VaMA to the AeHIN community. We are now opening the floor for questions. I see that we have questions on the Q&A box and the chat box. So for the first question, this is from Dr. Ronald Santod. I'm interested in how your real-time system overcomes connectivity issues in isolated areas.
So thank you. That was actually one of the findings that we saw in our case study, because in the Philippines there are a lot of areas with terrain difficulties. And although we would have wanted for the data to be uploaded real time, some of this data comes in on a near real-time basis. So 2 to 3 days after the vaccination team would come back to the rural health units and upload their data. But there are also some initiatives, as I've mentioned earlier, that their program managers would call these facilities and inquire about their daily vaccine coverage. So the program managers, usually at the provincial health office or the regional health office, would be the one uploading their data in the system. So as much as we wanted an ideal real-time um, uploading of this data, this is not really possible for areas with limited internet connectivity. But as I've mentioned, the ODK also has an option for offline. So they can enter it, and once they are in an area with stable internet connection, then the data can be uploaded in the system. So that's it.
Yes, thank you. Our next question is from Dr. Katya. It reads, what does it take for countries to adopt these tools in terms of costs and required technical assistance?
Thank you for that very good question. But I would also want to ask my colleagues from UNICEF Philippine Country Office, who's been more informed in terms of costing and technical requirements in scaling up to other countries.
Hi, hello. This is Rachel Pagdagdagan, knowledge management officer here in the Philippine Country Office. We are the ones working on the RT-VaMA from since 2022. But yeah, just to answer your question, country offices, I think it's very, it takes a very little amount compared to setting up an RTM tool from scratch. We can take into consideration the subscription costs, which we think is very cost effective. We're using Inform, as mentioned in the presentation of Jessica and Aldrin, and it's around 3,000 USD. But this doesn't have to be confined with just the immunization campaigns. It is unlimited projects. It also includes, it can also allow unlimited number of users. So when we were evaluating the benefits that we can get from Inform, I think it was something that would really help us, not just in immunization campaigns, but in real-time monitoring of data for different initiatives that we have. And immunization campaign is only just one of those initiatives. There's also some things that we could take into consideration in terms of training. of our stakeholders, of our partners, and that's one thing that we can also add in to the cost that we would be um, putting in our investments. Yes. So the good thing about RT-VaMA is that, as I've mentioned, it eliminates the need for a government partner or a country office to start from scratch, because you are leveraging the lessons learned of the Philippine country office in terms of the data that we can collect. So everything is templatized. We have templates for the XLS form, the survey forms. We have templates for the dashboards, and as well as knowledge resources on real-time monitoring. So we think that this is a good start to highlight the benefits of real-time monitoring. I do hope I answered your questions. In terms of data visualization, there's also some investment to be added in there. Power BI is not too expensive. I think we think that it's also cost effective. You can start with like $25 for a pro account. So this is something that, of course, had to be added in as well. Over. Let me know if you have questions to that. Thank you.
Thank you, Ms. Rachel. Our next question is from Dr. Tep. How do you determine the targets to vaccinate? And is it based on live birth estimated or real number? And is the ODK system able to interoperate with other systems?
I'm Roxanne, also part of the Philippine Country Office, and working as a Technology for Development Associate assisting in RT-VaMA. In terms of the question on the target population, admittedly, that's also one of our challenges here in the country. Coming up with the number that is really close to the real population. So how did DOH come up with the target population? So there are different inputs that came into it, like, for example, the annual census, as well as projected growth factors and movements in terms of population, and that was projected as part of the targets. It's also a wish to integrate the civil registry so that we can measure live births and include that as well in the target population. But unfortunately, that's also something that we are currently working on as a country, and also as a partner working with DOH, hopefully to help them out in that area as well. On the question of, what was the other question again? On the interoperability question, I think Sean gave a very good answer to this one. The ODK system can be interoperable with other systems as long as there is a defined data standard, and these systems aligning or complying to the data standards that are set, so are able to follow. I'm sure AeHIN is also advocating for FIRE, and so the data exchange could be seamless and interoperable between these systems. I hope I was able to address the questions. Thank you.
Yes, thank you, Mr. Khan. Our next questions are given the near real-time nature of data collection from isolated areas, how did you overcome potential data quality issues coming from these isolated areas? Also, what are the security measures that have been applied to make data secure and confidential?
Maybe I'll start with the infrastructure, because with UNICEF, we also have standards being implemented as part of any digital solution that is being used or rolled out into any situation. So that one, as part of already an internal standard in terms of security. And then there is also that arrangement or agreement with DOH in terms of what types of data can be collected through the template. And for RT-VaMA, we're only working with aggregates. So we're not storing patient line item data. Therefore, somehow it also removes some of the risks in terms of leaking personal information because we're only working with aggregates. In terms of quality of the data in the collection, I think it also helped that we have been doing learning sessions with the actual people or the enumerators who will be using the tool, as well as doing training of trainer sessions. So we assist people as they try also to do capability development on our partners on the ground, and be able to support them through different channels. Here in the Philippines, their favorite channel is Viber. So we are also on standby in terms of them asking questions through the channel, or if they are sending us, say, emails or direct messaging through, whether it's through our DOH colleagues or directly through the channels that we've provided for them. Thank you.
I would also like to chip in.
Yes, go ahead, Jessica.
A very short, I would only also like to chip in on how the data from the communities or health facilities are validated. So what I've mentioned in the presentation, there are coordination meetings by the program managers that happens daily or every 3 days. And the managers get to validate if there are spikes or if there are areas with very low coverage data. So they call up the health staff assigned in the facilities, and they would validate if there are some inconsistencies with the data. So that's one mechanism that we've documented in the case study. So thank you. Over to you, Ms. Rachel.
Yes. So yeah, I think that's also what I would want to say, that I think that's really the benefit of real-time monitoring, because we are able to um, be able to see where we can recalibrate sometimes way of questioning and our questions, and we can also see where what needs to be addressed. So yeah, just wanted to add that one. Thank you.
Thank you. We have a set of questions from Dr. Daniel. So for the first one, it reads, could you touch on the mobile devices used? Bought new devices or there was opportunity leverage? And how did you manage that?
So for the mobile devices, ODK is actually compatible with Android phones. But we also saw that, using the web browser, the offline version of the web browser was already enough, because initially we were training our enumerators to use ODK Collect app. And the ODK Collect app has its benefits, but at the same time, it might take a long time to somewhat set up. If we are talking of enumerators with very low digital competency, it can be a struggle for them. But when we were testing the web browser using an offline URL link, that's something that they appreciated. And even for the iPhone users, it was also something that they were very open to use. The good thing about RT-VaMA, the toolkit, we have a lot of how-to videos on how you could set up ODK Collect, and as well as using data collection using a web form through a browser, a mobile browser. For feature phones, admittedly, it was one of the limitations But we also encountered those requests because there are some enumerators, especially in GIDA areas, wherein most of the enumerators don't have access to smartphones. This is, of course, a limitation, and uh, there's I think one way that we have proposed is to use pen and paper and then go to the web browser once they are able to. So yes,
And thank
thank
you.
you.
The next two questions to that are: was this used for house-to-house campaign? And was there a geospatial coverage monitoring component? Did you document opportunity to use this system for routine immunization?
For the first question, if it's used house to house, actually we have forms that have been used for enumerators who go from house to house. This was the rapid convenience monitoring or the rapid convenience assessment. That's where our resources go from house to house to validate if there were children that were missed during the vaccination. The other forms are used in the facility. That's where we record performance in terms of how many children were vaccinated that day, or in terms of the readiness assessment, it's also facility based. On the question on geospatial coverage, um, right now, we are using a preset coordinates for facilities so that we are able to map them on the Philippine map. We would have liked it to be a real-time geospatial tagging. But right now, that is still something that we wanted to work on or improve for Inform and the data collection forms that we've created.
Yes, thank you, Mr.
Thank
Fan.
you.
And Dr. Dina also has another question regarding data use. Uh, it will be interesting to see how the campaign readiness data informed planning and implementation. Is there any synthesis that triangulates pre-campaign, intra-campaign, and post-campaign?
Right now, I think in terms of triangulating, um, that is not being done yet. But in terms of analysis for activities that are done pre, during, and post, at least there's a continuity in terms of visibility on the progress that is being gained all throughout the campaign. But maybe as part of improvements on the usage and the insights that are being gathered through the data that is being collected, that would be the triangulation would be a great idea. Thank you for that. We will take note. Thank you.
Just wanted to add in terms of that question. We have for just the recent MROPV SIA campaign, the rapid convenience monitoring form was used to identify areas that require mop up. And this would be if there are around more than two children that were not vaccinated in that area. So it helped our government stakeholders to somewhat identify where they would be focusing their support or going back to address the the areas that has unvaccinated children. So I think that's one use case wherein RT-VaMA was able to help address pressing concerns. Over. Thank you.
Thank you, Ms. Rachel. Before we hand over the microphone to our director for the closing, maybe just the last words from the UNICEF team.
I think, Jessica, it would be good to have your words. But yeah, we are very much thankful and grateful to have this learning session with all of you. What we have learned from Artivama is something that we are very much eager to share with with everyone, and we're hoping to really collaborate with our partners, with more partners, in helping improve real-time monitoring for immunization. Thank you.
Thank you, Ms. Rachel. But I'd like to invite Shalini or Ray from Office of Innovation if they want to share some word. Thank you.
Great. Thank you so much, Jessica. And Ray, please do come in. Yeah, thank you so much, all of you, for joining us. At the Office of Innovation and to the Philippine country team as well. We've been very happy to support on RT-VaMA as well as on the case study. And we're hopeful that this information that's been generated through the case study will inform the global body of knowledge on real-time monitoring. So please do reach out to us and to the Philippines country office and IAPRO on any questions or feedback that you might have for us. So thank you all again for joining us.
I have no further words, just thanking everyone for joining us. And over to you, Christine. Thank you.
Thank you very much to the UNICEF team. This is Dr. Alvin Marcelo. Thank you, Aldrin, Jessica, Roxanne, Rachel, Shalini. We learned a lot with your experience. I think we all know that the human resources are really the key to the success of our digital health interventions. I support the decision to use ODK, which is a digital public good, and that allows us to focus more our resources on the human capital. So thank you very much and congratulations. Good night, everyone. Thank you for joining our webinar tonight. Thank you, UNICEF.